All right. Hello and welcome. Let me get my levels right here to anatomy and physiology as we move across the skeletal system here with your professor, Dr. Shawn Clavell. And today we're talking about the pectoral girdle. Uh, primarily the upper extremities are part of the appendicular skeleton as well as the shoulder girdle associated with it, or sometimes referred to as the pectoral girdle. The two bones that make up the pectoral girdle or the shoulder girdle are the clavicle. That's the S-shaped bone located on the anterior side of the shoulder. So as you see that on the right side of your screen, you can see that there is the clavicle, and then most prominently seen from the uh, posterior portion is the scapula, and that's this portion right here. I'll make a little star right there to identify the scapula. So we've got the clavicle and the scapula that make up the pectoral girdle, and we'll talk about each of those here today. Starting with the clavicle. So first let's take a look here. You can see from that anterior view of the shoulder. There it is. And so if we can orient ourselves first, the clavicle is pretty prevalent here. So you can see that the clavicle is, let me get some writing tools here. There's the clavicle. The humerus is also here. You can see that is the arm bone. So the humerus, there's the humerus. And then we can see some small portions of the of the scapula. So let me kind of show you where the scapula is first. So first, let me kind of. So the scapula is right here. There's a portion of it that's sticking out. You can see that. As well, there's another portion of the scapula right there. So these are actually two processes of the scapula. So you can even see, maybe, let me get a little drawing tool here. Yeah, you can see the scapula kind of pokes its way out and around into there. But for the most part, you can see from the anterior part, you can see two parts here. Is the, let me erase my tools there. There is the acromion process. So the acromion process is the point that articulates with the clavicle, and the coracoid process. The coracoid process of the scapula. So there we have there. From the posterior, you can't really see the clavicle as well, but you do see the shoulder blade. So let's take a look at that from the posterior portion. There it is. There's the humerus, the scapula, and the clavicle being shown. Let's talk about the clavicle as we've mentioned. We'll take a look from the view here uh, that you have on the screen. Maybe let's even, we'll take off the ribs here to give us a better orientation. You can see there. And so as you'll see that S shape, the first thing that we'll see is that there's two ends. There's the sternal end, and the sternal end of the uh, the clavicle here is a little bit more broad and triangular shaped. Got it right there. There it is right there. And again, this is the sternal end of the uh, clavicle. Then the other portion here is the acromial end. And so the acromial end I'll probably identify here on the contralateral side. You can see here, there's the acromial end. The acromial end is actually a little bit more tapered and narrow than that of the sternal end. And so the way to identify that is, again, by its shape. There's also the other component here that we'll see. That as we move away or from medial to lateral, you'll see that there's the curve here, that the curve of the clavicle is in the anterior direction. You can see that's moving forward as you move towards the midline. And as you move laterally here, you can see that the curve of the collarbone or the clavicle moves posterior. You can even kind of identify that there on yourself. And so those are going to be some key features to help us identify first where the acromial end is and the sternal end, as well as whether you're looking at a right or left. Those are the real major components related to the clavicle. And so this is the clavicle from the top view. And so you can see here, as I mentioned, there's this big, broader end. This is the acromial end. So let's identify that here. So the acromial end, this is from the, so this is medial, excuse me, this is lateral. And then the sternal end is over on this side. And again, so as we've mentioned before, when you go from this, again, from medial, so I'll put a little M right here, to lateral, L right there, the first curve that you see is that it'll curve in the anterior direction, which is towards the front, right? So this is anterior, and this is posterior here. We're looking at it from the top view. And then as you move laterally, that is, you'll have that curve in which it moves posteriorly. So the keys here to the clavicle are to identify the acromial end, the sternal end, as well as the whether it's a right or a left. The next bone that we'll look at is the scapula. So the scapula is a very prominent bone that is in the posterior shoulder here. So we'll start again by kind of orienting ourselves from the posterior portion here of the shoulder or shoulder blade. And so the major component here is what you'll see or identify as the spine of the scapula. And so if you can find this portion right here that's referred to as the spine of the scapula, you'll always know that that is that goes posterior. So that goes towards the back. There it is. I'll kind of. And so that's a major landmark that we tend to see here. It's called the spine of the scapula. Maybe I'll just throw some arrows to it. And so you can see that there's a couple of borders here that we'll identify. There's the border that's out towards the armpit as the lateral border, and then there's the one that's closer towards the vertebral column. That's the medial border. And then on the anterior surface, you can see that the anterior surface is big and flat and articulates with the thorax through some muscles that we'll talk about in some later sections here. But again, the shoulder blade here, predominantly seen from the posterior portion, and that big prominent feature that protrudes from it goes in the posterior. It kind of leaves some valleys here up there and down below that allow us to for muscles to inhabit. Now, from the anterior direction here, we'll start by looking at the shoulder from the anterior. So this is the portion that's up uh, against the thorax, and so this is there's some muscles that sit in between the rib area. But let's first identify this first big major portion here, and this is called the subscapular fossa. The subscapular fossa. So if we kind of get a tool here, it's called and so the subscapular fossa sits right sits right there. There's your subscapular fossa. You can also see again some borders. So the borders here are referred to as the medial. So there's the big medial border here. We'll just use this type here. And there's as I mentioned, the big medial border, or referred to as the vertebral border. And that is that kind of the big expansive border here that extends from, let's see here, make it a different color, green, that extends all the way down here. And again, that's because it goes towards the thorax, or the ribs and the vertebrae. And then on the opposite side, you have what might be known as the lateral or axillary borders. So this side we have the lateral, or often referred to as the axillary border, because again, that's associated with the armpit. That's this portion right here, blue. As well, there are two angles associated with this shoulder blade bone. So you have the inferior angle. So again, we've identified a couple of features here. There's medial, there's a little lateral, there's superior, and inferior here. So we have the inferior angle. That is, I'll give this one an arrow. There's the inferior angle, and then there is the superior angle. Obviously, there's the superior angle, right? That too. Finally, there are a couple of features here from the anterior. You can see here there is what's identified as the shoulder socket. What makes up the shoulder socket? This is referred to as the glenoid fossa. So the glenoid fossa here. Take this one. Baby. And then the two processes, right? Remember, we've talked about these ones, the acromion process that extends from the actually extends from the spine of the scapula. You've got the acromion process. And the, let's see if you can see that. Yep. And the coracoid process. So let's see if I can't copy this. So the major features as you see them from the anterior portion, again, this is the anterior. So let's kind of put that here at the bottom of our screen. Anterior view of the right scapula. From the lateral view, we can also see we'll also be able to see what you'll see here as the glenoid fossa. So here we have the glenoid fossa. Well, yeah, you can see first. Well, maybe let's identify the axillary border. That's probably a good one there. So you've got the axillary border. That's this border right here that we see. You've got the acromion process. But you can see there's the spine of the scapula, and this is probably a good one to identify here. The spine of the scapula is going to be right there, and so you have two regions that make up. There's the. Let's identify there. There it is, right there. The spine of the scapula, the glenoid fossa. There. And then again, you can see your two processes, the acromion process. That, there. And the coracoid process. There. Yeah, and so this is just to identify here, right? Like the anterior is here. This is a lateral view of the, and this is posterior here. This is, again, lateral view of the scapula. And then finally, with our posterior view, we get the most obvious of features, the spine of the scapula, and kind of divides it into two compartments here. So first we identify the spine of the scapula. That is right here. And actually, as you come around here, what you'll see is that the spine of the scapula extends to become the acromion process, right? So we'll identify that portion continues to become the acromion process. That's right here. We'll move it around just a little bit for us. And so that leaves us with two major portions. We'll move the spine of the scapula onto the spine there. Two major portions. You have two fossas that sit above and below the spine of the scapula. You have, let me keep that, what may be referred to as the supraspinous fossa. Again, the supraspinous fossa. So let me see here. Supras fossa. And then the infraspinous fossa down below. So above the spine of the fossa, above the spine of the scapula, you have the supraspinous fossa. Below, you have the infraspinous fossa. And then again, you've got also have your major borders. So the long border here is the. Let me see if I can't move that for you here. So that long border here is the medial border. The lateral border sits here in green. You've got the lateral border here. There's the glenoid fossa sitting out there, as well as the the supraspinous regions that we've mentioned here before. And so that wraps up our portions of the pectoral girdle as we talk about the shoulder blade, the clavicle, and the scapula. And we'll move down towards the humerus, the radius, the ulna, and the hands and wrist in later lectures. Look forward to hearing from you guys. Take care and stay well.